This is an Andy's Randomness special report. Reporting now, Andy Pollack.
Let's see my mic on here. Ah, there it is, but we don't want that one. We want the main mic. Alright. Hello, everyone. Welcome to special news report from Andy's Randomness. That's much better. There we go. Okay, let me move a little bit to the left. Alright, so let's properly do this again. Welcome to the special report from Andy's Randomness. We are waiting for the weekly COVID-19 update from Delaware Governor John Carney, live from the state capitol in Dover. This is the weekly update that Governor John Carney gives each and every week for the state of Delaware. So we are going to wait for that. Each and every week we get clarity from Governor Carney on the school situation. We're going still with the hybrid model in the state of Delaware, which I do agree it's the right model to go with right now if the cases do go low, because remember, Delaware is a small state, but it's very easy to social distance in Delaware. I'll tell you that right now. It's not like New York where everything is just dense.
Available in here, yes?
Yes, okay, thank you. Very quickly, I also know it's Tuesday, so I'm just keeping an eye on to see if Ralph Northam is speaking today in Virginia. Just keeping an eye on to see if we have any updates from Virginia today. Okay, we do not have an update from Virginia today, because I would have been notified from WRIC. So I'm just making sure we're on the right page here. Okay, we're all good. So any moment now, we will be waiting for the briefing. The other update, probably it's going to be regarding how Delmarva Power handled the outages in Newcastle. I am just beyond annoyed with Delmarva Power. I'm sure a lot of people in northern Delaware today are still mad at them. In fact, we're down to now, 1,034 outages, if I can even pull up the map. It will shrink me down for a second, because shame on Delmarva Power. Shame on them. You know, the tornadoes happened a week ago, and a majority of Newcastle is still out. Especially in the Middletown, Odessa area. Those are residential houses. How are they still without power? Okay, I don't get that. Look at Kent. There's only 4 outages where we talk about the middle region where the capital is, Dover. Then you have Sussex, where all the rural areas are, where you have the farming folk, and then you got the beaches. They only got 4 outages. So I don't understand, how does Delaware, with Delmarva Power specific, and we'll get the numbers. Yeah, see, here's the thing. Delaware Electric Cooperative is only with Kent and in Sussex. That's it. So, I think it's time for Delaware Electric Cooperative to get involved, in my opinion, because to think that the tornadoes happened a week ago, I have been keeping an eye on the outages when they were first, I think, 3,000? 3,000's one thing. But how can you not restore the power? I mean, we're dealing with a different situation in New York. And, you know, New York is in a whole different situation I don't even want to get into today. I'm just solely focusing on Delaware. But you all get the idea that Carney's going to have to call out Delmarva Power today. I expect that in the briefing as well. I hope somebody's going to ask him his opinion on the Newcastle situation, because I think John does live somewhere in Newcastle from what someone told me. In fact, hang on. I just want to get a background. Make sure where John does live. Yeah, he's from Wilmington. So he should be very mad about this. That's Newcastle. He should be very irate. You know, just like how he was at Murphy. Very briefly, for the other Delmarva viewers, I just want to mention that each Tuesday now, I can confirm this, Governor Cuomo, along with Governor Murphy in New Jersey, and Governor Lamont in Connecticut, they're going to announce the states that get taken off or re-added onto the quarantine list. So we have more clarity of that. I found that out from 1010 Wins here in New York this morning. The bad news is I have to play the horn. I know. I hate playing it, but it's for a good reason. Maryland and Virginia are still on the quarantine list. Can't make this stuff up. But at least another week where Delaware is still off the quarantine list. So if you're coming from Delaware and want to come to New York or New Jersey, even Pennsylvania, the good news is they're not on the quarantine list. In fact, I do have an update from Pennsylvania. The good news is from Tom Wolf today, no new quarantine issued, I think. I will get into that as well for those viewers who go between Delaware and Pennsylvania. That's understandable. Take 95. Pennsylvania quarantine. Just want to get a list. Okay, quarantine visitors. Want to get some clarity on that. Oh, I think they updated on Thursdays. Okay. That's very important because I'm looking at the PA Department of Health website. Okay, right now, last updated August 6th. They give an update on Thursday, so I'll have to update this when I can. Oh, the good news is Virginia and, what else? Yeah, Virginia, Delaware, and Maryland are not on the list. That's very good. So, Tom Wolf, please do not be selfish. That's all I'm going to say, because you're going to make a lot of people in Delaware and Maryland very mad. And keep in mind, for our peninsula, we get visitors from Pennsylvania all the time. All the time. So please do not upset those people, because you're going to make them feel upset. Update right now regarding Governor Carney. We may have to wait until 2 p.m. for the briefing at the moment. But I am looking live on Vimeo livestream. And we do know right now that Governor Carney is going to speak at any moment. Sometime around 2 p.m. And I'm going to cover these briefings each and every week until Carney doesn't say so. In fact, hang on. I have a tweet from Governor Carney right now. I have a tweet from Governor Carney. Oh, never mind. This is from earlier today regarding the extra housing for Delaware, which that's important given this given these circumstances. So, figured while we're on the topic of Delaware news. Might as well just look up some news stories to keep you guys distracted. Okay, good news is Delaware Live is Delaware Online has a let me just unblock the ads. Because I was supposed to turn off the JavaScript for this thing. My God. Yes, okay. I like the picture they put on the website. Yeah. Oh, they have a thing about Biden. Because remember, Biden is from Delaware. Keep that in mind. Let me just block the JavaScript. We have a... I do not want to deal with nonsense. Okay. Wow, another tornado on Friday night. Let me look at this article. Third twister of the week that was updated today. I'm going to read this article, and what we'll do is whenever we wait for John to speak, we'll just read from Delaware Online and also take a look at the Cape Gazette while we're at it as well. Keep you guys occupied until we hear from John. Okay, so let's get into it. I'll turn off my camera for the remainder of the... no, I'll keep it like this, and then if I need to put it back on, I'll put it back on. Okay, tornado in Delaware. Investigators confirmed third twister of the week touchdown on Friday. Just double checking to see we still have that. Okay, just double checking. After surveying storm damage over the weekend, the National Weather Service determined a tornado touchdown on Friday, August 7th in northern Delaware. So, there you have it. Another tornado to touch down in Delaware. Third one in the week. It wasn't even related to Isaias. This was the tornadoes that came a couple days ago. Okay. It still had to deal with Delaware's significant damage. It left less than half as long as 3.8 miles over 11 minutes. It still dealt Delaware significant damage. Fallen trees put as many 14,000 households and businesses without power. As of 3 p.m. Monday, still. Now, look at this. Let me zoom into this. Let me zoom into this Delmarva power issue. Here we go. The company estimates that all powers in Newcastle County will be restored at 11 p.m. tonight, 11 p.m. Monday. Well, here's the problem. It's Tuesday, and Newcastle is still reporting 1,034 customers without power. So again, shame on Delmarva Power. They should have had the power back on by now. You know, I hope, again, John does bring this up today, or somebody asks him a question, but, you know, given the circumstances, remember, the schools are opening in a couple weeks, so John's going to have to prioritize that. Okay, here we go. Look at this. It says, Ashland Nature Center near Brankenville and Barley Mill Roads near Hoskin. And continuing east, knocking multiple trees down on Piles Fork and Campbell Roads, causing damage along Kennett Pike between Kirk Road and the entrance to the Wilmington Country Club. The tornado tore through the country club, damaging about 200 trees before lifting at 5:51 p.m. in the Rockland and Concord Pike area by the PA state line. Winds reached 105 miles per hour. And Delaware does get tornadoes. 6 tornadoes were confirmed in 1992, 5 in 1975 and 1993, 4 in 1967 and 1994, 3 in 1977, 1984, and 1989. So they do get tornadoes. But not as much in recent years. Delaware has gotten very lucky. So we do get tornadoes. But lately we get more flash flooding in Kent and Sussex, which that doesn't surprise me anymore. But surprisingly, we've gotten very lucky with that this year, so far. But things could change. Still could get flash flooding in September and October. Look, Delmarva Power had to call in other utilities. So this is what I mean. Why couldn't they get Baltimore Gas and Electric or the New Jersey people to come over? They could have called them over. But no, they don't want to do that. Oh, this is interesting. Look at this. This is on Friday. Okay. Yeah, so Carney was in Newcastle a couple days ago. Look, here's a quote that Carney even said. I lived in Delaware most of my life. I don't think I've seen two back-to-back storms like that. Well, we've had them before in Delaware. Okay, I don't know what's going on with the feed today, but I'm just going to refresh this. And we're still off the air right now, so I have no clue when we are going to hear from John Carney. I was hoping by now. A little bit off guard. So let's just read this article, I guess, about Biden. The Hotel Du Point. Curious about what this place is. Let's Google it. It's in Wilmington. Okay. There you have it. Okay, we may have to keep an eye on this situation. Potentially today or tomorrow, former Senator Joe Biden will make his announcement. Former VP, of course. The New York Times also reported an announcement could come today or tomorrow. Okay. Mr. Biden's house in Greenville. Dark color vehicles were parked outside of the house. Yep. Okay, I'm just quickly reading through this. Right, so Biden will not travel to Milwaukee to accept the Democratic Party's nomination. Here we go. We're live. Here's Governor Carney.
That I go into when I go to pick up, take out food in a restaurant. I see I have my mask on, as do the people who are serving me at the counter, and the same is true in restaurants across our state. So a couple weeks ago, we disclosed the conditions under which schools could go back into session in September, and the school districts have been really working hard, superintendents and their teams getting plans put together for their boards. We're clearly in scenario number 2, which is the yellow scenario. 2 of our criteria, the new cases on a daily basis at 56.5, which is very strong compared to where we've been in the last month or so. Our target there for green is to get that 56 number to 10. And our percent positives, which continue to be strong, driven in part, AJ, by your team's work in getting more people tested, and the testing that's happening in other venues at 4.2% positive. That's not today's number. Today's number is better yet than that at 3.8%. That's the number for, I want to say, Saturday.
Week to week, yeah.
Week to week.
August 1st through August 7th.
There you go. So that's going to be our measure for the schools. Daily hospitalizations comfortably below the gating criteria there, which is 10 new cases, and we're at 4.3. So solidly in scenario number 2, and each of the school districts are in the process process of developing their plans. As I
Hang on a second, folks. Do apologize for the technical difficulties. What I'm gonna do right now is we're gonna share the stream live right now on Twitter. While I'm at it, we're gonna figure out why did I have two streams up. So let's start all over again. Once again, Governor John Carney.
It's increasing at all retail establishments that I go into. When I go to pick up, take out food in a restaurant, I see I have my mask on, as do the people who are serving me at the counter, and the same is true in restaurants across our state. So a couple weeks ago, we disclosed the conditions under which schools could go back into session in September, and the school districts have been really working hard, superintendents and their teams getting plans put together for their boards. We're clearly in scenario number 2, which is the yellow scenario. 2 of our criteria, the new cases on a daily basis at 56.5, which is very strong compared to where we've been in the last month or so. Our target there for green is to get that 56 number to 10. And our percent positives, which continue to be strong, driven in part, AJ, by your team's work in getting more people tested and the testing that's happening in other venues at 4.2% positive. That's not today's number. Today's number is better yet than that at 3.8%. That's the number for, I want to say Saturday.
Week to week, yeah.
Week to week.
August 1st through August 7th.
There you go. So that's going to be our measure for the schools. Daily hospitalizations comfortably below the gating criteria there, which is 10 new cases, and we're at 4.3. So solidly in scenario number 2. And each of the school districts are in the process of developing their plans, as I said a minute ago, working hard with stakeholder groups. Most districts have large teams of teachers, staff, administrators, parents involved in putting those teams together, and they'll be presenting those to school boards. Most of the boards are still in the process of reviewing those plans. We do have an example of a hybrid plan that has been approved by the Cape Henlopen School District. Here it is, an example of a hybrid plan. Families have the option. They're giving families the option. They're surveying their families now. They did a survey earlier. I think about 60% wanted in-person or a mix of in-person and remote learning, and about 40% of their students in an earlier survey wanted just remote learning. So they're going to have a mix of in-person and remote learning. Families have a choice. The elementary schools will have a remote option for parents who select that, but they'll be open 5 days a week for in-person instruction, space permitting, meaning the configuration of the classrooms. They're working closely, as all the districts are, with personnel from the Division of Public Health that have been assigned to each of the districts, and working closely on making it safe for children and staff. We know that children are not as susceptible to the virus. The concern primarily is with teachers and staff there. And of course, then in the middle school and high schools, a remote option for parents who would like that, and then 2 days per week in person, again, space permitting, almost like a college model, if you will, where you go to class a couple days a week, and then you do your work at home, and you're working on papers and other assignments, a mix of remote and in-person instruction. So this was an example of Cape Henlopen School District. You can view their plan at capehenlopenschools.com/reopening. It's a very lengthy document that addresses many of the issues and all of the concerns that stakeholders have, and we would recommend it to you to give you an idea of a district has developed a hybrid model, a mix of remote and in-person instruction with family choice. Most of the districts are continuing to work on their plans and prepare them for submission to the boards who ultimately make that decision. You may have heard this week that the DIAA, the board that regulates high school sports in our state, has come up with a recommendation or a plan to delay sports into the latter part of this first semester into December and determining what's happening on the ground. They looked at the various options there. And I think in light of the fact that some of the schools and high schools will be in totally remote situation, and given the situation on the ground and the need for transportation and all the logistics of high school athletics have moved, like most of the states around us, by the way, Maryland, Pennsylvania, New Jersey, mostly a similar degree, with a same kind of a decision. So we did announce that.
Do apologize, folks. We had that minor technical difficulty, so we'll try to rewind back if we can get to where we were. Do apologize. We'll get the technical difficulty fixed in just a second. Okay, we are having an issue with the live stream now. Hang on a second, folks. My Wi-Fi is not the best, so we'll try to do it this way.
I think it's really important to highlight.
Okay, we are having a technical difficulty.
The importance of
Let me try to rewind
rental
back.
assistance or mortgage
Here we go.
assistance. You can find it at destatehousing.com/COVID-19, destatehousing.com/COVID-19, a $40 million fund with a $5,000 limit targeted towards families back to school for in-person instruction, and two, to get, when you're in public, you're keeping social distancing. When you're in public, you're being careful when you go into restaurants to be separate and follow the instructions. And if you run a business like that, you're following the rules and regulations as well. Well, for me, the overall objective is now we have something very tangible, two things very tangible to target, and that is to get more children back to school for in-person instruction, and two, to get as many businesses reopened and doing business in a semi-normal situation, certainly with more normal revenue than before, so that they can be successful and employ Delaware.
And want to make sure that people are thinking about that as well. Additionally, needed, unfortunately, are not effective.
Be successful and employ Delawareans. So with that, I want to turn it over to Dr. Carol Rattay. We want to welcome her back. She had a couple weeks where we had other guests from the Division of Public Health, and we want to thank Dr. Hong and Dr. Pescatore for their great work and for filling in as we talked more about testing, particularly testing of teachers and school personnel, and we'll talk, AJ will talk a little bit more about that today. So Dr. Rattay?
Great, thank you, Governor. Our numbers are looking pretty good, as Governor Carney just said. Of course, we would like to see our numbers go down. Certainly, we do not want to see increases in our numbers of cases and our percent positive and our hospitalizations. For right now, it looks like we're in kind of a mild to moderate level of community spread. And so again, it's out there, the virus is out there, and it's really important that we do everything we can to prevent spread between individuals, and especially outbreaks like super spreader events. And so I wanted to go over just some of the latest learnings in the research to talk about what we know now to best prevent the spread of this virus. Masks, face coverings, we've talked about them a lot, and we continue to have evolving, growing evidence that says wearing a face covering and wearing a mask is the most important thing we can do to prevent the spread of infection between individuals, to prevent super spreader events. When you look at some of these events, many in different places across the country or the world, these super spreader events almost always involve a lack of face coverings. And as we talked here before, I think one of the best case studies of showing the effectiveness of masks was these two hairdressers who saw 139, they served 139 clients, very close contact between hairdressers and clients for prolonged periods of time. And because everyone was wearing a face covering, the hairstylists themselves and the clients, no one got the infection. So again, face coverings are so very important. There are a couple of updates. In fact, in the last couple of days, there was a study that came out looking at different types of masks. And so I think it's really important to highlight the importance of the different masks and knowing what works the best. Face coverings that have multiple layers of fabric, which is the type that many of us do wear, these are the most effective. In fact, this study showed that these are almost as effective as N95s, which are the high-grade face coverings that healthcare providers wear. So these work really well. Unfortunately, these gaiter types of neckwear, it's just a single layer of spandex. A lot of people wear them while running and put them up when needed. Unfortunately, are not effective. This study showed that these really don't work well. In fact, you may even have an increased spread of droplets with these types of face coverings. So we want to make sure people know not to wear these gaiters to prevent spread, but really wear the type that has multiple layers. It's also very important that it covers your nose and your mouth, and it fits well around your nose and your mouth. CDC, Centers for Disease Control and Prevention, just yesterday put up new guidance around face coverings with valves. I want to make sure people are aware that valves are a hazard in that droplets, aerosols can go through the valve, and so it is not protective or preventive in spread of the infection. Additionally, face shields, which many people like because you can see the mouth. They also cover the eyes, which is good. But alone they are not adequate because they do not have a seal around the mouth and the nose. So important information about that. Also, I wanted to mention medical exemptions. There are a lot of folks who will claim they have a medical exemption to wearing a face covering, but the reality is true medical exemptions are extremely, extremely rare. It would be someone who has a lot of difficulty breathing, maybe somebody with COPD or serious severe asthma, and those are individuals who the science has made very clear are also at very high risk for severe consequences of COVID-19. So we recommend that people with those conditions for which they don't feel comfortable without or wearing a face covering, that they really should not be in public places where they are exposed to other individuals anyhow. I also wanted to mention age. You know, we've talked a little bit about this. The American Academy of Pediatrics and the and the Centers for Disease Control and Prevention have recommended all along kids 2 and up. It's strongly recommended. And what we are seeing out and about, in fact, I just was at the mall recently, I saw a lot of younger kids, 4-year-olds, 5-year-olds, very comfortably wearing face coverings. So we are seeing more and more that this is becoming a norm for children, and want to make sure that people are thinking about that as well. Additionally, a physical activity exemption. A lot of folks think, if you are physically active in a gym or walking around in a gym or even weightlifting in a gym, you don't need to wear a face covering. Really, it's only those who are engaged in vigorous physical activity, which is running, or running fast or cycling fast, stair climbing fast, where your heart rate is really increased. Those are really the only times when you shouldn't be wearing a face covering, and that's especially when you're indoors. When you're outside and you're distanced, it's fine to walk or bike without a face covering, but we want to make sure that folks who are in gyms lifting weights know that they really should be wearing a face covering, because that is a risky behavior. The World Health Organization recently came up with a really nice document around ventilation. So I wanted to touch base on this. This is, as we have seen over and over again, a really important factor for these super spreader events. And so in all indoor environments, workplaces, schools, churches, anywhere that people are spending time indoors, it's really important to make sure that there's fresh, clean air. And on the next slide, we talk a little bit about HVAC systems, which are really important. A well-maintained HVAC system can reduce the spread of COVID in indoor spaces by increasing the rate of air exchange, reducing the recirculation of air, and increasing the use of outdoor air. It's also very important to check HVAC systems and change filters regularly, whether it's in our home or workplace or churches or any other place where people gather. Also, WHO points out that restroom facilities, the exhaust fans in these are often not fully functional. So it's important to have these checked out as well to make sure that they are operating at full capacity. But the reality is outdoor air is so very important. So above everything, if you can open windows and doors while indoors, please do so. But very importantly, use outdoor spaces as much as possible for all kinds of activities. And finally, I want to touch base on singing, cheering, loud speaking, voice projection, yelling. We've talked about that before, and we actually have guidance in place secondary to seeing some outbreaks related to singing, where it was assumed that aerosolization of these respiratory droplets was happening during these activities, and evolving science is really showing this to be the case. I want to give a shout out to the Wilmington Children's Chorus and Philip Duchette and others who have been sharing with us some of the recent research in this area, which again is showing that yes, spread does happen from these activities. They also shared with us a study that showed certain wind and brass instrumentalists like saxophone and tuba and trumpet also generate aerosols at high rates. And part of the issue with these activities is they're often inside, and they usually do take place for longer than 15 minutes. So you get these aerosols circulating in the air that people breathe, and that causes the problem. But there are things that you can do to mitigate the impacts. And so on the next slide, we talk about recommendations. We certainly don't want to tell people not to sing and or in theater to project yourself, or in churches, or coaches who are yelling. But there are things you can do. Wearing a face covering is the most important thing to do, and again, a recent study shows that singing with a face covering is a very effective way to decrease the spread. Of course, again, we want to encourage at least 6 feet apart. If a face covering is not going to be worn, with these activities, we strongly recommend staying at least 13 feet away from people, facing away from the audience, as well as using a physical barrier such as a sneeze guard or a face shield to help prevent the spread. Additional recommendations include for wind instruments or other brass instruments, you can use a bell covering on the instrument and a modified face covering for those who are playing these instruments. Voice amplification can be very effective, whatever setting you're in. If you're teaching or coaching, using voice amplification makes it so that physiologically you're not exuding the same amount of aerosol. So that can be very, very helpful as well. Again, we see a lot of coaches who are pulling down their face covering to yell, and that's the exact opposite of what we want people to do. Keep that face covering on and use like an electric bullhorn and electronic whistle instead of these other approaches that can spread viruses. Also, a recommendation that came out of this study we saw was between activities, for example, between choral activities, air out the room for 30 minutes for good ventilation between activities, and that can make a difference as well. So again, preventing the spread, we gotta stay vigilant, we gotta stay home when we're sick, And wearing a face covering or a mask, again, is probably the most important thing that we all can be doing, as well as staying at least 6 feet apart, especially if we are not wearing a face covering, and spend as much time outside as we can, especially if we are around other people who are not in our household. And with that, I will hand it back to the governor.
Thank you very much, Dr. Rattay. Great information about mask wearing. I say it each week, I think, on our White House calls. Consistently, the message is if you want to flatten the curve, if you want to prevent the spread of the virus, that we need to increase compliance on mask wearing. I hear it, as I've said before in the past, from Republican governors of Florida, of Georgia, of Texas, of Arizona, and now you're starting to see in each of those states their cases starting to trend in the right direction. And you know, the experts will tell you a lot of that's due to better compliance and focus on mask wearing and social distancing. They are the main tools that we have. Each of us can employ those tools, and we would encourage everybody to do that, to take care of yourself, your family, and your neighbors. AJ, you're going to talk a little bit about testing. Really continue to have a little bit of a drop in testing because of the weather, but we continue to really ramp it up, and it's an important part of our response to COVID-19.
No, thank you, sir. And yes, so testing continues. We did lose a few days last week. I'll talk about that in a second. But this week, again, have about 10 sites up in Newcastle County. No doctor's orders needed. You can make an appointment or show up. Or, I mean, the good thing is we are not turning people away, you know, during these events. We've been able to accommodate just about everybody that's shown up really since the beginning. So these good. You can go to de.gov/gettested. To find out locations and times that are convenient for you. Kent and Sussex, same URL. You can go to check out, and we got 4 events this week there. Very successful day yesterday in Dover, and I think, you know, we're kind of in routine. People know where we're going to be there, and getting some good numbers, weather depending, and that leads me into the next thing. So we did see a decline the last 2 weeks. We lost about 3,000. We didn't lose. We, you know, we're down about 3,000 individuals last week that got tested. Testing events on Tuesday were canceled due to the tropical storm. Friday's events up in Newcastle happened to be evening events, and they were all closed early due to the severe weather that rolled through. So we have the capacity, we have the events. You know, unfortunately, we have to deal with the weather as it comes up and causes some issues, but we continue and march on. We're still rotating around to make sure we are able to, you know, get to different communities and, you know, get people tested. The Walgreens partnership's been working very well. Looking in the next few weeks to expand that, and Dr. Rattay will hopefully have some information on that in the next week or so. But again, that will give us just a little wider foundation that we go out there and help get out in the community. And then we continue to develop or to look at new options, and that takes us to the school and teacher testing. So as we announced last week, we are going to be rolling out teacher and staff. So anybody that works in schools that could be there while students are, including bus drivers, tested. And then we're going to do about a quarter of them a week ongoing. So, you know, it's good for surveillance and make sure they're done once a month as well. So we have, again, expanded the type of testing. We're going to be using another saliva-based test, so it's very you know, easy for individuals to do, and it gives us additional lab capacity. So now we have what the public health lab could do, what we're doing through Curative, and now the Vault being the third lab or the third component to that. So exciting to get that off the ground. We know that's been something the teachers and staff has schools have been, concerned about, and hopefully that will make it just that much more safer as we get students back in the classroom. So the second part of that, and something we're working on, and it's a little bit moving target, as Dr. Tay mentioned, and the governor, the schools are presenting their plans right now to their boards to get approval for how they are going to go back. So we are going to greatly increase community testing over the next probably month. It's going to be focused around the school district. So we are going to try and have several days of testing in school districts, depending on the size of the school district, about a week prior to students getting back in the class. However, right now, this is kind of in flux, as we know some school districts are deciding what model they're going with and what date they are going to be going back. So as we get those confirmed through our partners at Department of Education and the districts, we'll be rolling out the schedule. And I want to make sure it's clear that if you are in, Colonial School District, but you happen to be somewhere else the day they're testing there, we don't care where you take your kids to get tested. They could go to any one of these sites. They're going to be open for the community as well, but we are going to be, probably doing twice to 3 times the amount of testing for several weeks there. So it's going to be a heavy logistical lift, but we're going to be all over the state concentrating on high schools just because they have the footprint to accommodate the drive-through and walk-up individuals. So more to that as we confirm that. Probably had the first 2 weeks planned out by the end of this week, early next week, and we'll share that with you and also communicate through the school districts so parents see it as they get their kids ready to go back to school. Governor?
Yeah, so AJ, great work. Thank you for your attention. I think it was 3 or 4 weeks ago I said to you at one of our meetings, I want to test every teacher and every member of the school staffs across our state as they reopen schools, and you've got a really good plan to do just exactly that. It's a plan that I think will be easy for teachers and staff to make sure that they get tested, since they can basically do it themselves at home and register with the testing company. Will have those results in advance of they're coming back into buildings, and then we'll test them regularly after that, and continue to focus on making sure that the schools are safe places for teachers, staff, and children. We think that we can do it. The key is in continuing to win this battle with COVID-19, to flatten the curve, to crush the virus, as I say, is for everybody to help out by wearing a mask, by practicing social distancing, by following the restrictions. And if we do that, we can get our children back in schools. We can get back more to a normal way of doing business in our state. We can open businesses more fully, and we can strengthen our economy and get people back to work. So we're all in this together, and we're going to win this battle together. So with that, again, we thank the media for covering our press conference today so we can talk to our constituents and the people that we work for, the people of Delaware, and answer any questions that you have. Meredith, thanks for being with us again.
Hello. Just to start off, a clarifying question about testing within school staff. Is it required for staff members and teachers to get tested? I just saw has the opportunity.
Yes, so from the state's perspective and public health, they can't make them, so that's going to be something that's up to the school districts. So it's highly encouraged, we'll put it that way.
Oh, okay. So I'm just curious. Again, I know previous comparisons with nursing homes, apples and oranges, but I am curious why the state would recommend nursing home staff but not teachers at this point. So
I believe there's a licensing component to that too. I'm not sure if Dr. Tay wants to add anything more, but I think it's just, the school districts are the ones that employ the teachers.
And just to follow up on that, does the state plan to publicly track any infections if and when there's confirmed cases in schools?
Yeah, so we absolutely will be tracking, any infections that might occur in the school setting. It's a part of our case investigation work now for every case. It's one of the questions that is asked. Schools would be considered one of the high-risk settings, and so whether it's the school that might find out first that there's a positive case or public health, we will work very, very closely with the schools, with the school district in responding. There may be times when there's really no need for the public to know. For example, if a person was positive but no one else would have been considered exposed, that's unlikely to be made public. However, if there are exposures and there's reason to make the public aware, we will work with the school district to make sure that people have the information that they may need.
And we've talked about it quite a bit in these press conferences over the last month or more about our contact tracing protocols and systems. Obviously, in a controlled environment like this, those contacts and those interviews are a lot easier to make. It's also something that we're working with the University of Delaware on for similar purposes to identify people who may have been come in contact with somebody who tests positive.
But as of now, there is no plans to have like a running list of schools that have had confirmed cases that would be available to the public?
Not at this time, no.
And then just my last question, for the governor, I know there have been reports of the Ohio governor testing positive and then testing negative for the coronavirus. I'm curious how often you get tested yourself and what kind of test you use.
I was tested, I want to say, once. Was back. My son has been working remotely and living with us. He works for a computer science company who actually does work in the healthcare space in Cambridge, Massachusetts, but they've been all working virtually, and so he was home and not feeling well, and so he was tested, as was I, and my test was negative. I believe that's the only time that I've been tested. I did quarantine once as a result of one of the staff who tested positive, and just served out the quarantine. It was not necessary to get tested because I did the quarantine instead.
Has any of your other staff members tested positive? Just to follow up on that question.
Not that I'm aware of.
This is from Amy Cherry at WDEL. Can Delaware afford President Trump's unemployment, which appears to require states to pay for 25% of federal unemployment?
Well, Delaware is going to use part of its CARES Act to pay for the unemployment benefits that have already been paid out. And so we, with our own revenues, can't afford that. And we will be taking out a loan from the federal government for our current obligations and payments that we'd have to make going forward. And so this new action, executive order by the president, is very complicated and frankly unnecessary. We ought to have had action by the United States Congress. We thank our congressional delegation for working hard for an agreement there to extend within the current framework those resources and that support. It's important support. It's important. It's support that's necessary for Delaware families that have been unemployed. Delawareans who've been unemployed have to support their families. We talked earlier today about our rental and mortgage assistance programs for just that purpose, to help those who are unemployed, and these benefits are incredibly important as well. And so we would encourage the Congress to act to build on our current system, which is not nearly as complicated as this, but we don't have the resources right now. We're using federal resources for the benefits that are being paid as we speak. It's just an unnecessary and complicated way of addressing a real need for the people of Delaware.
From Mallory Metzner at WRDE, is there a timeline for phase 3 yet, and what would it take to get to that point of reopening?
Yeah, so the phase 3 is an interesting challenge for us. Our major objective, as I said earlier on, is to get as many children back in front of teachers and schools as possible, and we're working on that, and their work and school districts are working on that. Many schools, because of concerns over safety and some of the restrictions, operational restrictions, have chosen to go with fully remote learning. Other districts like Cape Henlopen, which we highlighted today, have a mix, a so-called hybrid model of a mix of remote and in-person instruction. And we want to continue to have that movement from fully remote to a hybrid to fully in-person instruction. And to do that, we have to have conditions on the ground that warrant it. We're almost there, and we're getting there. And so the way to do that is to really lean into the guidance and restrictions on activity that exist. There isn't much that would happen if we went to so-called phase 3, any changes, but it would send a signal to folks that, frankly, is not the right signal to send now, which is we've accomplished our goal to stomp out the virus, and we can go back to normal now. So it's really a question of balancing that messaging out, the need to continue on pace, to wear masks, to social distance, to stomp down the virus and enable us to bring children back to schools and businesses more open so that they can get revenue and survive, put people back to work. So we have two objectives: reinvigorate the economy and bring children back to school. They're connected, and so that's what will guide our decisions with respect to the remaining reopening that has to occur. And most of that is around, restaurant capacity and gatherings and places that are at the greatest risk of transmitting the virus in our communities.
From Kate Tabling at Delaware Business Times, doctors across the country are hoping for continued measures and insurance reimbursement for telemedicine options, and Delaware has recently lifted more restrictions on telemedicine with a recent bill that you signed. Since many doctors predict that telemedicine will be here to stay, what long-term measures will you and your administration be looking at in terms of telemedicine, as that bill has a sunset provision of July 1st?
Yes. So we've talked about telemedicine in Delaware for years, going back to my days as lieutenant governor, when I did a lot of work in healthcare, health disparities, and healthcare costs, and small business health insurance, and the rest. But in the context of COVID-19 and this pandemic, with the risk of transmitting the virus, telemedicine has been a godsend. And it's been incredibly important to the delivery of healthcare services and getting patients in front of physicians safely, particularly primary care physicians, to get a prescription to go and get tested or whatever the case may be. And that's why we, through legislation that I signed, put in place with a sunset certain terms for telemedicine practice here in our state. They will be important practices going forward, and we will look at some of the conditions as that need to be addressed in a long-term basis. As the sunset approaches in July of next year. We also have to take our lead for Medicare and Medicaid in terms of reimbursement. As an employer, the state will establish fees that will pay for telemedicine, and we need to think about how that will work and how it can create efficiencies in the delivery of healthcare services in our state. And I know it'll be an important way of doing healthcare services in the future, and we look forward to addressing any issues that occur over the next several months.
From Nick Cialino at Delaware Public Media, are many school districts reaching out to the state for guidance in formulating their plans for the fall?
Yeah, so one of the things that we've done, and I'll ask Dr. Rattay to comment on it as well, back when we were talking about the conditions under which schools would reopen, partially remote and partially in-person instruction, and as we move into the scenario number 2, the yellow scenario, which is kind of a hybrid model, we assigned individual professionals and experts from the Division of Public Health to work with educators, superintendents, instructional experts and leaders in the schools and school districts to develop those plans and really to focus on the operational challenges that teachers and schools encounter with children. And I think that's been really helpful to schools, and it's been a way that we've been able to provide real good advice to that decision making. Dr. Rattay?
Yeah, absolutely. We have received a lot of good feedback. Our public health experts who are working with the districts are very busy, meaning that the districts have been spending time working with them, asking questions. And I, in fact, received from one particular district some really positive feedback about the experience. They're finding it very helpful. So we're really glad to be able to support the districts in that way.
From Sophia Schmidt at Delaware Public Media, the University of Delaware is requiring all students, faculty, and staff to be tested within 14 days of arriving to campus. What is the state doing to prepare for what will likely be a surge in testing demand?
So I'll let AJ handle most of this, but first of all, we're trying to ramp up testing more generally to the public. We talked today about testing all teachers initially before they reopen the schools, and then periodically through the month, as well as testing students and children in our elementary and secondary schools. So that's a big commitment in and of itself. We've got employers, the University of Delaware being chief among them, are bringing students and faculty both back on campus, and they'll be tested there. So we do have big challenges, but we also have seen some innovations in testing technology, and we're taking advantage of some of that. So it'll be a challenge, but I think AJ and his team are up to it.
Only thing I would add is that is why we keep on looking for new labs or new capacity. But it's as we look at the school plan. So we have to hit all these districts at the right time to make that test effective for that school district as they go back. So it's a map and a logistical lift to make sure we're effective. But the big thing is as we get those dates, the farther in advance we have information from whether it's a school district, an employer, University of Delaware, the better we'll be able to accommodate them. We don't want people to travel, across the county, but we also know that we only could be so many places in one day.
And then the final question's from Sean Green at WDEL. The DIAA voted last week to suspend sports competition until December. Do you support their decision, and do you have any concerns about Delaware high schools not having competition while club sports continue, and that this could create a pay-to-play model in Delaware?
Well, first of all, I know how important athletics is to our students and our young people generally. As a lifelong athlete and somebody who played 3 sports in high school and 2 sports in college, and I know how important it is to motivate young people to do well in school, to go to school in the first place, and to have a fulfilling life. So I know how hard the decision that DIAA made. I appoint a number of the members. Some of the members are appointed to the board by organizations that they represent, be they superintendents, teachers, members of the public. And I know it was a very difficult decision, particularly in light of the fact that many of the high schools, the focus of much of the sports that the DIAA regulates were going in fully remote, meaning not having in-person instruction. And so the idea, there are several ideas that they considered, weren't able to get a consensus around. A lot of that as a result of operational challenges with busing and with practice and all of that. And so I think their decision was based mostly on safety and on the decisions that were being made in states around us. The decision of DIAA was consistent with what we've seen in Pennsylvania, Maryland, and New Jersey. And so in that, I think they've made a good decision going forward. I do think that we need to look at youth sports. I'm not sure we're fully comfortable with the way some of the sports tournaments and competitions are being managed, particularly from the perspective of following appropriate public health guidance, and that will be something that we're looking at. I know DIAA, I know the athletic directors, the superintendents, parents, teachers, and coaches, and concerned members of the public, and frankly, your governor will be eager and interested in getting our students, our young athletes back on the field, back on the courts, enjoying the sports that are so important to their lives. And very difficult decision for DIAA. And I think in light of the situation in each of the school districts with respect to remote learning, the appropriate decision at this time. So with that, as the final question, again, I want to thank everybody for joining us today, for following the press conference, and most importantly for what you're doing to help us flatten the spread of the curve, reduce the spread of the virus, COVID-19 in our state. It's still here among us, and so we need to be smart. We need to get tested. Even if you're not feeling sick with flu-like symptoms, make sure you continue to wash your hands and use sanitizer. And most importantly, wear a face covering, a mask when you're in public. Avoid large gatherings where people are bunched close together. When you're in a gym or at a youth sports event, be it a Little League game or a Summer League basketball game, make sure you're wearing your mask and keeping within 6 feet of other fans and your ball players. And if we do all these things, then we're going to get to where we want to be and have our children back in school and our businesses back online. Thank you for joining us, and we look forward to seeing you the next time.
All right, so there you have it, the weekly Governor John Carney briefing. Just going to go over a quick lapse. Pretty much, Governor today talked about schools reopening again. State of Delaware is still planning to go with the hybrid in-person phase of learning at the moment, but again, guidance could change, and things certainly definitely change with this virus. There is more news that the testing sites that were closed during Isaias are going to reopen. They also gave guidance today on social events. Very specific on that today, so big kudos to the health director for Delaware today for doing that. But nothing was brought up regarding the storm. So am I surprised about that? Not really, no. Not really, no. So I'm just going to quickly try to pull up the pop-out chat. And next week, I'm going to try to stream it from Facebook. I may have better luck from Facebook next week if I can try that. Or best case, we can just upload these videos and then do them pre-taped, which would be a better option. But I'm not seeing anything else on the live chat. So I think with that, we're going to wrap up the special report. So, that being all said, thank you for watching.